I'm Lisa Birnbach. Sometimes what you think is a really bad head cold turns out to be a sinus infection. And when that's the case, the treatment is different. But how can you tell whether it's a common cold or a sinus infection? Here with us to explain is Dr. Jordan Josephson, an ear, nose, and throat specialist and author. Dr. Josephson, why do we call it common cold? It's not so common.
Common cold is very common, more common than you say, so it is common. Everybody has had a common cold. It usually lingers for 2 to 5 days. You're just feeling run down, kind of clogged up in your nose. You can't breathe, sore throat, just achy, maybe you have a little fever. So it is a common cold, and if it lingers for more than 5 days, then you probably have a little bit more than the common cold.
If you're a worrier, what do you do? If you're running a fever for days and days?
You can help yourself. First of all, eating right is very important.
Why do they say feed a cold? What can you do for your cold by eating better or eating more, especially if you're not in the mood?
Well, the bottom line is when you have a cold, your resistance is low. You want to elevate your resistance. And how can you do that? You can do it by eating properly, staying well hydrated, vitamins, supplements. Things along that line will increase your resistance and get you to knock the cold out of the box.
Now, if it's a sinus infection, can you treat it yourself with over-the-counter products, or do you need to see a doctor and get a prescription filled?
Yes. Early sinus infection, if you have it, maybe it's once every third year. You know, fluids is very good. Irrigating your nose with saline sprays, maybe using a neti pot or an irrigator. Those are all wonderful things to treat your sinus infection. If you have allergies that are causing the sinus infection, you may want to take an antihistamine. I'm not real high on combination medicines, but if you speak to the pharmacist and break it apart and take some of the over-the-counter stuff, that may be helpful to you.
Mm-hmm. Now, do you know that your sinuses are infected because they're swollen and you can feel it and they're tender to the touch?
Many people will tell you that they have headaches in this area, around their eyes, in their forehead sinus, in their cheek sinus, and in the sinuses in between their eyes, and sometimes even achiness behind their eyes. Chronic sinus infections are common. 30 million sufferers in the United States suffer from chronic sinusitis.
And what does that mean? That means that they're always dealing with that stuff?
And many of them think it's normal, and it's not normal. And the good news is, even people that have had treatment before, whether it's medical or surgical, that have failed, there are new combinations of medical therapy and surgical treatments that can give them a possible success and relief of their symptoms.
Dr. Josephson, if you do need sinus surgery, what should you know in advance?
Well, number one, sinus surgery is reserved if medical therapy fails. Number two is, for those people that have had medical therapy and or surgical therapy in the past, the newer techniques we have now give them renewed hope for feeling better. Number three is, when I do sinus surgery, it's done under a local, so there's no general anesthesia. There are almost never any black and blues. We very rarely put any packing in your nose, and people that have had sinus surgery in the past say that packing is miserable, and it is. People are typically back to work the next working day and need a few Tylenol, and that's about it. So it's not a devastating type of surgery.
So do you remove sinuses? Does the person need all of his or her sinuses?
What we do is we take through the nostril micro instruments and telescopes, and what we do is we take out the blockages in the sinuses and open up the passageways so that sinuses drain normally. And what we try to do is return the sinuses back to their near normal state.
Dr. Josephson, of all the treatments, Eastern and Western, that are available now at your disposal, what is the one that excites you the most?
The one that excites me the most, and I irrigate myself, is irrigating with either a neti pot or a nasal irrigator. And they work wonderful, or just even a little spray, saline spray, that you could just keep in your pocket and irrigate throughout the day.
Really? And is neti pot old world, new world, east, west?
These all came from Eastern philosophies. They've been around for thousands of years. They've worked. There's almost no risk that I can think of. So there's only upside. How can you go wrong with that?
Thank you so much, Dr. Josephson.
Thank you.
I'm Lisa Birnbach.